before anything else, I want to say I'm incredibly excited. Honestly, I'm very thankful that you are allowed to have this time with you. And like I said before, I just want to have just a nice conversation with you because there are many matters that they are very important for my community growing older with HIV and also the HIV long-term survivors community. For the people that they are listening to us, Dr. Monica Gandhi is a professor of medicine, and she's the medical director of the HIV clinic at the San Francisco General Hospital, WARD86. And there's an important project right now, something that just started, that is the Golden Compass, that I still remember. I'm sorry, but I was remembering when we met that you used to say, oh yeah, we just got the name because of the movie.
Yeah, yeah, it is different.
So I just want to say that, and also that you do have a background in, I saw some of your awards in mentorship and teachings.
Yeah.
So let's start with this. When did you start working for the San Francisco General Hospital, WARD86?
So I actually have been at UCSF for 20 years, and I came as a medical student to do a rotation here because San Francisco General was where it all started, an HIV rotation on the inpatient HIV consult service, and all I wanted to do was HIV. For 20 years. So then that inspired me to come to UCSF to train, and then came here, did infectious disease fellowship, and then ended up coming back to San Francisco General in 2008 and have been the medical director here for 3 years now, since January 2014. And yeah, I'm very interested in teaching, mentorship, and education of community trainees in medicine, fellows, residents, medical students about HIV.
The last time that I met with you, and I was lucky to meet you through The Last Man Standing, that whoever doesn't know is the documentary that is based in HIV long-term survivors here in San Francisco. Is the first documentary that the Chronicle ever made about these issues. One of the very, very, for me, very touching parts in the movie is the simple image when you see the pages of the people that were dying in San Francisco General Hospital. And you see the pages passing over and over. And when I was just entering this building, I started to get a little bit touched because I started to feel all these people that in those days precisely were one after one dying right here. WARD86 has been at the front of the movement in HIV, I can say at an international level. Now we have something new called the Golden Compass. So tell us a little bit about it. Tell us what it is about, why will it be important for our community, what's new with this?
Yes, so you're right that WARD86 started in January 1983, so it is one of the oldest and one of the largest HIV clinics in the country. And a lot started here, and we have always tried to think of innovations in HIV care that addresses what's going on in the epidemic at that moment. And started a PrEP clinic and hepatitis C treatment, and started everyone on antiretroviral therapy in 2010. Before that was the guidelines at the time, and the idea was to try to stay ahead of the epidemic. And so the aging, HIV and Aging Initiative really was because, exactly like you said, it's now 2017. People who did survive, and many people didn't, but people who did survive are much, much older, and even older people are being newly diagnosed these days. And there is an intersection between HIV and aging, meaning everyone ages, but there is something about being HIV positive and having chronic inflammation, having chronic infection all the time that can make that aging process nudge a little faster and happen more quickly. And when we say that, we mean rates of heart disease or stroke or memory issues may happen a little bit earlier. May not, because we're getting better and better with therapies, but there are a lot of people who are on old therapies at the time. So we started this Golden Compass program. That name actually came out of a focus group. And patients
so yeah, we want to know the real story.
Yeah, we like the patients who were advising us, who are over 50, like the word golden, but golden years sounded like a bad TV program, and like it didn't somehow, the compass part of it came out of how much navigation is needed when you're older and dealing with all your health problems. Like, we have to go here and here and here, and can we navigate and all come together in one place, like the compass points here. And so the idea came out of their ideas, and it's the Golden Compass program, and the concept of this is to provide holistic care for HIV in patients over 50. And by holistic care, we kind of define it as the 4 points of the compass. So north, we call heart and mind, and that means the increased rates of cardiovascular disease or any problems with cognition that can occur. We're addressing that head on. We just started a cardiologist coming to our clinic so that people don't have to go and navigate. The cardiology is going to be on site so that patients have easy access to the cardiologist. We just started a brain health class, which is starting next week, where it's a 9-week session, and it's to train people on tricks to improve memory and cognition. There's a lot of sort of exercises you can do for your brain. Then the east part of it refers to pain and bone strength, frailty, really getting people strong. And so we started two things, an exercise class, just started yesterday, and it's sort of for all different levels of fitness. And we are now recording everyone who has a fall or frailty is referred to the geriatrician, and we have a designated HIV specialist geriatrician, Dr. Meredith Green, on site.
I love Meredith,
So she, in fact, we're mandating people to see her. I mean, the patient can opt out, but we're telling the providers, we're not waiting for you to refer. If the patient's over 70, if the patient has fallen, they need to have a geriatric assessment. Then the west is dental, hearing, and ophthalmology, these services that are so hard to get to and track and figure out where you are, and we're making that easy for people by tracking and directing them to appointments and having as much as we can on site. And then south is social navigation and loneliness, and that is
isolation and loneliness, one of our
major
problems,
and this idea of isolation and losing your community. And so we have started a support group that meets on January 27th for the first time, next Friday. And beyond the support group, we're going to have activities, we're going to have movies, we're going to have a class on estate planning, DPOA planning, anything that people want to hear about, we're going to organize for them. So it just launched January, and we're going to try to report on all the metrics, do surveys of people, saying how they like it, how they want to change it. It's only for this population, and it's very special to us. It means a lot to us to start this.
Monica, what are the requirements if someone is interested in being part of the Golden Compass? Not only, of course, do they have to be residents only of San Francisco? Is this model also being passed to other states or other countries?
Yeah, this is a good question. It seems, and we've really looked around, it seems as if we are the first program that we found like this, a holistic designated HIV and aging program. So I think, again, WARD86 is trying to innovate and disseminate a model for the rest of the country and world. Not yet, meaning we need to really evaluate the program, develop metrics, ask people how they like it, do surveys, really figure out what works and what doesn't, refine it, and then disseminate it as a model. The only qualification is being over 50 and being able to come to WARD86 in some way. And we are working on making that very broad, who can come to WARD86, because we've gotten inquiries from people outside the city, and we are trying to be creative about anyone who wants to at least access the classes, can come to the classes. None of these classes are, you don't have to be registered at the hospital to come to the brain health class. So we are, anytime someone writes us, we put their name down and we tell them about all our programs.
Okay.
So we're very excited and hopeful about the outcomes of this.
Wonderful. By the way, our community is also very, very excited about it. There's a couple of questions that come out already from the things that you've been telling me. Correct me if I'm wrong. Is Meredith the only gerontologist in the Bay Area, California? I know that gerontology is one of those areas precisely that, for whatever reason, is not like the most popular profession, and we need it very badly, precisely because not only the community in general is getting older, but of course our community of HIV is getting older. What is the knowledge that you have about that?
It is true that she is one of a kind in the sense that she is the only geriatrician in the Bay Area that I know of that's focused exclusively on HIV. There are actually many geriatricians, so it's not that that's a dying breed of specialty.
But in HIV.
But she's made her career entirely on the interface between aging and HIV. So she has great expertise on why this drug that would be, given for HIV treatment would interact with a medication that would be given for high blood pressure or diabetes or conditions that usually affect people when they're older. So she has that expertise. That's been her focus. And so we're lucky to have her as our in-house geriatrician. And we're aiming to get her to see, we have about 1,400 patients over 50 in WARD86. And we're aiming to get her to see as much as possible, many of those patients as possible, for a comprehensive assessment. And little things can make people's lives, this is what geriatricians do, but little things can make people's lives a lot better. Tweaking a medication, suddenly people aren't as fatigued. Changing a drug-drug interaction where people are feeling nauseated. Little things can make people's lives better, and that's what geriatricians do. They think about every aspect of a person's life. Loneliness and falls and where's the carpets in your house that you could trip on. It is really a unique thing that they do, and she's then even more uniquely trained with this population.
Are you okay? You need some water right now or something?
No. Do you need some?
No, I'm fine. Thank you. I want to get a little bit in the more particular health issues. Like I mentioned to you before, the group that I'm lucky to be the one that founded, we have 4,000 members right now. There's one very, very important matter that is affecting us, and even if getting as a result that some of these people are being disqualified with some resources because they're taking in consideration sometimes the amount of T cells that they have, because if my T cells are over a certain amount, they are kind of normal, and my viral load is undetectable. Many people are saying that we're living a normal life. What is happening, and I really invite you, of course, if one day you want to visit the group, is online, is that many of us, including me, that we have good T cells and a detectable viral, we're still getting sick of many weird things. That's the way that I call it, because sometimes they don't even find explanations. I was talking to a couple of other doctors before too, and it has been for a while been taken in consideration just these two aspects, T cells and viral load. But still, again, we're getting there's a certain amount of KS coming back, of course, a certain amount of cancers, skin, etc., besides, of course, mental issues that will not disappear sometimes just because your T cells are fine and your viral load is undetectable. I want to know your take about that. One of the last conversations that I had with one of the doctors on a higher level too was precisely that we need to start taking in consideration other elements, not just the T cells and the viral load, because again, there's many of us still very sick in other matters. What's your take on that?
Yeah, I mean, that is a really active area of study. It's this question of if you're on medication, it looks like your T cells are okay, your viral load's suppressed, is that it? Are you fine? And, there's data that there still may be elevated levels of inflammation, even in that case. And beyond that, for survivors who've been positive for a long time, there was the exposure to the old medicines, which were not very easy to take, and a lot of people struggled and were extremely brave and resilient to take medications that had so many side effects, but there were a lot of side effects, and we don't know the long-term side effects of those earlier medications. We think these later medications are safer, but by definition,
we don't know
they have not been studied for a long time.
Thank you.
So we don't know, you can never say to someone, well, you can never invalidate someone's experience that they don't feel well.
Sure.
Obviously, and there are absolutely, sort of molecular studies that may show that people may have more inflammation, or still their guts may leak a little bit more, and there may be things that are happening. And even if you can't quantitate it, it's absolutely true that aging itself, if it's accelerated, then you're going to get illnesses earlier just from all the chronic inflammation that happened before people had an undetectable viral load, or the times that they went up and down. So you're right. I think it's a condition that you can never say shouldn't be managed by an HIV specialist. I really do believe that. I really believe that our field moves so fast in HIV that I will give talks, and if I haven't updated it in 2 weeks, I'll be behind the times. So I feel like immersing, it best serves a patient for the provider to be immersed in the field, to think about it a lot, to look at the literature all the time, to go to the conferences, to be, in my opinion, as it moves so fast, it's such an active and exciting research community, we should be keeping abreast of anything that can help our patients. And there are little things like maybe some of the nucleosides shorten your telomeres, which is something that can make you age faster with your chromosomes. I mean, there's even in vitro data that can happen that makes you think, okay, maybe I won't use that drug. I did this with a patient yesterday. He said, I want to live forever. I said, okay, I don't know, I think that you're on a good drug. Maybe there's some in vitro data that I would make you I would want you to be on this one. And he said, okay, go for it. Change whatever it is, on the latest finding, try to use what's ever going to make me live forever. So I think it's a very good question, and I think everyone is open to trying to keep on figuring out why things happen. And I agree, those are crude parameters, they're just two numbers, but they may not represent the whole picture.
Yeah, what happens is precisely that, some people, again, without even mentioning right now, certain agencies, they've been denying these resources to people that now have, again, good T-cells and viral load undetectable. While, again, many people are telling me, but I'm still very sick. My energy level is still very low, et cetera, et cetera. By the way, the favorite word of these times, yes, precisely, is inflammation.
Yes.
That's the word right now that appears in every paper and every study seems to be there. But tell us, just for someone that is not familiar with any medical terminology or anything, and someone comes to you and tell you, oh yeah, it might be inflammation. How do you define this?
Yeah, I mean, the way I have explained it to patients is that if you have flu, if you have a virus in your system, like influenza virus, your whole system gets revved up. It gets just excited. It's just doing everything it can to fight it. And that revving up can have unknown consequences. It can make arteries more thick. It can, you're facing an emergency, so you don't care about the long-term consequences of what you're trying to do. The body is trying to fight off this infection. But if you have an infection that goes on for a long time, the body can stay revved up, and it may not be the most adaptive thing for the body to stay revved up. You're not fighting, you don't want to fight constantly, and that can cause wear and tear on the body, and it can cause arteries to become more thick and plaques to develop in arteries that can thicken them, and it can just lead to just a state of where the body gets tired, literally gets tired and more exhausted, and things are used up faster. And so it really is, it's like our fight or flight response. Like it's constantly trying to fight something, but your body needs rest. And so that's what antiretroviral therapy does. It gives the body rest in the sense that it's not fighting actively virus in the plasma, but it may be fighting actively virus elsewhere. I mean, just because it's undetectable, the viral load in the plasma doesn't mean it's gone, obviously. We know that from the body. So there's always a chronic fight happening.
Many people were asking me precisely then, is there something that medically can be done at this time to fight inflammation, or things that we can do in our normal lives to fight it? Is there something that you have heard or recommend?
The main thing that I can recommend is exercise, and then I'll tell you about the other possibilities. So Absolutely, it's being studied, completely being studied. There's a big study with giving an anti-cholesterol medication, a statin, not because of cholesterol, but because of inflammation itself. There's smaller studies that haven't shown it about aspirin. Can we reduce the inflammation from aspirin? It doesn't seem like that's working so far. There are other studies looking at fighting other chronic infections that people can have, like cytomegalovirus, and helping that virus go away so that, or recede so that you have less inflammation. But it is true that one absolute thing that people can do is exercise, because that does, while we're waiting for these other studies to come out, while we're waiting for more data to understand, is there another pill, is there something else to be taken, no question that is a beneficial thing in so many ways, for cognitive function, for reducing inflammation in the body, for peace of mind, for endorphins, for depression, for anxiety. There's just a lot that exercise does. So that is, I'm constantly talking to my patients about this. Like, even just walking, that time that you're going to walk, just walk up the stairs, or if you need to take a bus ride, walk those 5 blocks. Like the little things that we can do to work into our day.
Yes. Okay, thank you very much. I just want to finish with a couple of last things. And hopefully you'll give us a chance to have part 2, the conversation with Monica Gandhi, because, again, we really appreciate this. Let's just go back for a moment to the Golden Compass. In the group, I always try to take in consideration our diverse community, women and transgender and straight people. Sometimes they seem to be, in these days, with less resources than the gay men, and there was a time that gay men needed a lot more of these things. Is the Golden Compass also doing something for these other communities, or research, or
This is a great
women,
question.
transgender, and straight people?
This is a great question, actually really dear to my heart, because I am interested in HIV infection in women. That's been a long-term clinical and research interest of mine. So we are actually just writing a grant where we're trying to work in the she form of Golden Compass, meaning like any special services for women. Let's deal with menopause, let's deal with hormonal repletion, osteoporosis, things that may be more geared towards women, and we're writing for funding for that now and hope we get it. And then we have been asked in the social groups, a patient of mine asked this, who's a heterosexual female, she said, will you do dating groups? And I said, well, we are thinking of putting, if people, when we're going to start with one social support group and then decide how people want to sort out. And if it ends up that way, then people will probably end up being in a group that hopefully provides them with social opportunities.
Wonderful.
So, and then transgender care at our clinic has been a big focus, actually, over the last year. We really are doing everything we can to provide culturally competent care. We have to figure out, it's a great question, figure out specifically aging in transgender, which I've not done, so we'll work on it.
Yeah, that would be almost like a whole another conversation. My last question for you. Today is, oh my God, it's a very special day in many ways. It's the day of that Donald Trump started his presidency. And many people are very nervous and very anxious about the changes in policies and how they might be affecting us and how it will affect even the General Hospital, our medicines, the Golden Compass, all of us. Send your message of hope.
Yeah, my message of hope is this city, and also people who work in HIV, and I mean like worldwide, are never going to stop fighting and working for patients who live with HIV, not only ending the epidemic in terms of prevention, but having people who have HIV live longer. People went into HIV for a reason. Believe me, it's not a high-paying specialty. It's not like people went into it from dedication, from a sense of social justice. It is a wonderful community, just like the patients are wonderful. The providers believe in this, and they will never, ever, ever stop. So I have a lot of hope that it's going to be okay. We're going to continue to fight for the funding and the resources that we need for HIV-positive patients, those who are older. And admittedly, we live in a city that's the same way, but I think this is true across the world. Everyone is coming together in solidarity.
Well, we really, really appreciate you, and I had to give you
Thank you. It's really nice to talk to you.
Dr. Monica Gandhi.
Thank you so much. That was a very nice interview. You asked great questions, and it was very nice. And it was like beautifully in time.
I was